the Supreme Court. Yep, thank you. Backup recording. I'm going to roll that back and do that again. That's Megan. She's got me. I know how to surround myself with good people. Thanks, Megan. So welcome, everyone. My name is Denise Monroe Rosnack. I am the Vice President of Advocacy for the National Federation of Business and Professional Women's Clubs. And I really want to welcome you to today's event. 50 years ago today, today's January 22nd, 2023, and it was 50 years ago today that the Supreme Court decided on Roe v. Wade, and that gave us protections and federally protected the right to abortion across the country on a national level. But as we all know, that unfortunately, that decision failed in a sense to reach 50 years in play, right? Because it was essentially rolled back during the Dobbs decision. So we are very, very fortunate to have the Advocacy Committee and the Health Committee partner together to bring to you an expert speaker, Dr. Sophia Yen, who I'll be introducing shortly, and who will guide us through her 8 tips now that Roe is gone, which is so sad to say. Carrie Hess is our chair for Health Committee. Wave, Carrie, I know you're out there somewhere. I think, Carrie, I didn't warn you too much, but do you have a word or two that you'd like to share with us real quick? That way I know I put her on the spot. I'm so good at that.
That's okay. Health Committee is really committed to exploring this topic and trying to come up with ways to message to the rest of BPW how important it is to be involved in this issue. And so while Deneen did most of the work in securing this presentation, we were really happy to support her and cheer her on in setting this up. So thank you so much, Deneen.
Oh, thank you, thank you, thank you. And it has been an exciting honor, and really I just have Dr. Yen herself to thank because we were on another event and we were in a breakout and I mentioned the organization and she volunteered very excitingly to speak to our organization. And so it just sort of worked out that we both felt that this day, being the 50th anniversary of Roe v. Wade, would be the ideal day to do this presentation. So I do want to take just a moment. If you don't know, this is the Lunar New Year, and we have probably heard that there has been a mass shooting outside of LA during Lunar New Year Festival, very near the heart of Chinatown out in Los Angeles. And so I just would 10, I believe, fatalities and at least 10 injuries. So I'd just like us to take just a moment and send our energies and our good feelings and our hearts and compassion to all of those who were impacted by that and what seems to be unending list of tragedies and traumas related to gun violence. So just for a moment. Thank you all for that. I know that was brief, but I did really want to take a moment to acknowledge that.
Denise,
so without further, yes.
Denise, Monterey Park is where I live. Yeah.
Was that Linda? Because it's not,
Yeah,
oh,
there were 10, 10 killed, 5 men and 5 women, and 10 were injured, and maybe they caught him in Torrance. They aren't exactly saying for sure, but he killed himself. If that's whoever they caught in Torrance, he killed himself. So anyway.
So right, wrong, or indifferent, I in many ways count that as an additional fatality. I know that does not usually get counted, but my opinion is that people who hurt people. And so no excuse for the actions, but obviously something was disrupted there as well. So thank you, Linda. And feel free to share any insights that you get along the way to kind of keep us posted if you hear any inside news. But yeah, getting really exhausted announcing and acknowledging these things. But here we go. We are, more things for us to address and educate and empower on. So the list, we don't fear running short of that list. So moving on to the topic of the evening, I am very happy to introduce to you Dr. Sophia Yen. Sophia Yen, MD, MPH, is the CEO and co-founder of Pandia Health Birth Control Delivery. She has a passion for making women's lives easier, preventing unplanned pregnancies, and educating women about #periods optional. With more than 20 years of experience in medicine, she is board certified in adolescent medicine. She graduated with a BS from MIT, an MD from UCSF Medical School, and an MPH from UC Berkeley in maternal child health. She serves as a clinical associate professor in pediatrics in the Division of Adolescent Medicine at Stanford Medical School and is a reproductive health specialist. She has co-founded 3 nonprofit organizations and projects in her endeavors to improve the lives of women. There's the Silver Ribbon Campaign to Trust Women, SheHeroes.org, the full campaign, or FFFL.co, standing for Female Founded, Female Led. It is a B2C campaign to get consumers to actually choose female founded and female led businesses, all things being equal. She co-founded Pandia Health because she believes that no one should suffer from pill anxiety, the fear of running out of birth control, and they shouldn't have to stress having to obtain birth control each month. Dr. Yen enjoys educating the public and other physicians about birth control, menstrual regulation and elimination, sexually transmitted infections, acne, obesity, and other adolescent health issues. She's spoken at South by Southwest, TEDx Berkeley, MIT, Stanford, UC Berkeley, UC Merced, UC Davis, UC Riverside, many local high schools, boys and girls clubs of the peninsula, Facebook, and even grand rounds and noon lectures at various, and has given grand rounds and noon lectures at various academic institutions from Stanford Pediatrics, internal medicine, emergency medicine, to UCLA internal medicine. So if that doesn't tell you how lucky we are to have her, I don't know what to tell you. But ladies and gentlemen, I am so pleased to introduce to you Dr. Yen. Feel free, folks, to put questions in the chat as you go along. I'm just going to let her do her thing because she's the expert, and we are all super excited to see her. Dr. Yen, thank you. Take it away.
Thank you, Deneen, for such a warm welcome. And I want to thank all of you for coming out on a Sunday. But I think it's so important that we commemorate the 50th anniversary of Roe v. Wade, giving those of us in the United States with uteri the right to decide what happens to our body. I call it freedom of religion. I call it the right to bodily autonomy. And without that, what are we but second-class citizens? So it's unfortunate that it was reversed, but these are my 8 tips now that Roe is gone. And I know you can see my slides on the side, but I'm a little OCD, so I like to control what slide I go to next in case I want to jump around. But feel free to pop any questions you have into the chat. Yay, Deneen and I share many interests in the same aspects of life. So,
that's right. I forgot to introduce the most important information. Dr. Yen and I are birthday twins. Go ahead.
So tip number 1, if you don't know about plancpills.org, bookmark that, share that, do what I call a public service announcement. I use my Twitter, my LinkedIn, my Facebook as a way to just share public health information. So you can say, I was at this great talk sponsored by BPW, and this was the public service announcement. Or if you want to give Pandia Health credit, I label mine Pandia Health PSA, public service announcement. PlanCpills.org is a nonprofit website, and you punch in your state and it gives you your options for medication abortion for your state. They also have a free hotline if you have any medical questions about medication abortion, and a free hotline by, I believe, If, When, How, which used to be Law Students for Choice, any legal questions you might have about medication abortion. And this slide allows you to learn about aid access, which is by Dr. Maria Gompertz. She's in the Netherlands. And if you might have heard the story, she created this group called Women on Waves. And so in Europe, where there are countries where abortion is illegal, she would take women out on boats, take them out to international waters where the law of whatever country she took them from no longer applies. It's international water, so there is no law, it's lawless. And then she would perform the abortion, and then she would go back. And then she realized, oh, I don't have to take people out on boats. I can just mail them pills, and they take some pills now, some pills in 24 to 48 hours, and then they can have a medication abortion that works 97 to 95% of the time, as long as you do it before 12 weeks since your last menstrual period. And she had the prescience to realize that Roe v. Wade was going to go away. So she started a company called Aid Access, where she writes the prescriptions from the Netherlands. They ship the medicine from India, and therefore nobody in the United States gets sued or loses their license or anything like that. But unfortunately, Dr. Gompertz can never visit the United States until the United States reinstates Roe v. Wade, but she's been willing to give up her right to come to the United States in order to provide women in the United States who need these services. So the negative of it coming from India is that you can see here on this slide, it takes 14 to 21 days. And as many of you who've had uteri, I had it, back in my day, if you miss a period, you just wait for the next one and pray really, really, really hard that the period would come, because you just didn't want to buy that pregnancy test. It was really expensive and you just didn't want to deal. And you just hoped it was stress that was pushing your period. And when it came, you're like, oh, thank goodness. But now we need to advise anybody in hostile states that as soon as you miss that period, go get that pregnancy test, pee on a stick, and get your stuff taken care of, because many states have a 6-week cutoff. And the 6 weeks is not like you call a Planned Parenthood at 6 weeks. Nah, because, everybody's backed up now because there are fewer providers than ever. And so you really need to have it ready to go when the emergency happens. And so another opportunity you can see here is they allow you, if you look under the includes part, it's small font, but if you go to the website, get pills now for future use. It's only $110, and it includes a doctor talking you through this when you need it. And so you just, when you sign up, you say, I don't need it for today, I need it for the future. Often they can send you pills that will expire in a year or 18 months. And so if you have a young person with a uterus that that is going off to college in a hostile state, might be a good investment per dorm or per floor or per sorority or something for somebody to have these pills from a liberal state and bring them in. And then, you don't talk about where you got it from. So this is just really important information to know about and to share and to know that you can get it in advance. The other useful resource, if, we're in California, I'm in California, but you all are not in California. So take note of your states, take note of your color. If the color is not green, then you are not in a happy state. And the darker the red, the more unfriendly the state is. And this screenshot's actually old because I'm pretty sure it's now illegal in Tennessee. So go to the site. The site is run by the Center for Reproductive Rights. They're a nonprofit. I served on their executive board a while back. BC, I call that before children, so at least 16 plus years ago. But I served on their board, and they're a great organization. They are the legal arm of the reproductive rights movement, both nationally, internationally, and they update this website weekly, if not daily, if not by the hour, with the latest restrictions in whatever state. So if you have any questions about what the laws are in your state, go to this, but you can also call the if, when, how abortion hotline. Actually, it's called a warm line. Hotline means it has to be staffed a lot more hours, and they only staff it as much as they can afford to staff it. So that's another resource. And then if you were to Google pregnancy center, or pregnancy center on Google, 60% of the time, they're going to serve you a crisis pregnancy center. And they're not labeled crisis pregnancy centers, but when I did a Google of crisis pregnancy centers, they outnumber, we actually know on a national level, there are more crisis pregnancy centers than there are clinics that provide abortion. And so crisis pregnancy centers are nonprofit organizations that offer free pregnancy tests, free ultrasounds, diapers, and babies' clothing. What they don't tell you is that they're religious organizations whose goal is to scare women about abortion, and they frankly tell lies. If you get an abortion, you're going to become a meth addict. If you get an abortion, you're going to become sterile. If you get an abortion, you're going to be so depressed, you're going to kill yourself. All three of those are myths. And these are just examples of their names you could never tell. Birthright of San Jose, Real Options Medical Clinic of Redwood City, Real Options Medical Clinic of San Jose or Central Valley, et cetera, et cetera. It sounds like real options, but they don't give you all the options. As a physician, we are required to provide informed consent and to give all the options. These people are not medical practitioners. They may wear a white coat. The way you realize that it's kind of suspect, as my kids would say, sus, is they ask you to run your own pregnancy test. That's kind of suspect, but they'll do the ultrasound. But it's just, you need to be careful and knowledgeable about these. So what are the good, safe websites? These are two safe websites. The National Network of Abortion Funds and the National Abortion Federation. So the National Network of Abortion Funds you see here, those little purple dots are where they have funds. They pretty much have funds in every state, though I am seeing Utah does not have a fund. And people can call them up and ask them for money and be like, I can't afford transportation, I can't afford childcare, I can't afford the procedure. And those of us who have the means to help can donate to help those with uteri who need assistance getting the care that they need. National Abortion Federation are a bunch of providers that provide safe, legal abortion, and their website is prochoice.org. They have a secret meeting once a year that they make sure that they check everybody. We went to the meeting and they wanted to make sure because they don't want to get bombed. The other quote, they call themselves pro-life, but they are not pro-life because they're bombing doctors. And I always call myself pro-life because I'm pro-choice, because I know that if you make abortion difficult to access, more women will die. So I always call the other side anti-abortion, anti-reproductive rights, anti-religious freedom, anti-bodily autonomy. So that's your political framing. Words matter. Don't let the other side claim righteousness. We are the side that is out there for choice and protecting people's lives. If you know anybody in a non-liberal state, aka not California or New York, or maybe even Washington, delete your period apps. Period apps have become very prevalent. They're a lot of fun. They're very cool. But I can tell you, I went to MIT, and if it was ever on your phone, ever synced to the cloud, ever on your computer, we can find it. Only if you smash it and throw it in the bottom of the ocean and you swear to goodness that you never synced it to the cloud. But as we all know, our cell phones are doing things against our will, as is our computer, and just syncing stuff. And we've heard incidences of other companies, not necessarily our company, because we made sure we didn't do anything like that. They inadvertently synced their clients' information into the internet. And so it's not out there, but if you worked at Facebook and you really wanted to find it, you could find it. And there has been a case where Facebook Messenger between a mom and a daughter were subpoenaed, talking about them helping her get a termination of a pregnancy she wanted to terminate. So Teresa puts in the chat, for cybersecurity perspective too, turn off your location services, because if they find you anywhere near an abortion clinic or a clinic that provides abortion, even though 97% of the services they have at Planned Parenthood is to prevent unplanned pregnancy, sexually transmitted infections, and breast cancer and pelvic cancer, et cetera, they can still make you suspect. optimize birth control. So the next slide is going to surprise, I think, some of you and most of you, I'd say, because when I present it to doctors, even doctors get this wrong. So before I show it to you, in case you'd like to test yourself, imagine all of the birth control methods and imagine which one you think is the most effective, and then work your way down. You ready? The reveal, dun, 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 as my children say, dun, dun, dun. The implants. Who knew that this rod that you stick in your arm that Canada just got? I love Canada. Canada's amazing. But I was like, oh, you guys don't have a whole category of birth control? And they just got the implant. We in the United States have had it at least for like 3 to 7 years or more. Canada didn't get it till recently because they wanted new data, but it was so old that the drug company's like, I don't want to redo the studies in Canada. Forget that. So the implant. Stick a rod in your arm. As I used to say when I had a 10-year-old, now she's 13, a 10-year-old could do it. All you got to do is measure 8 centimeters from here. Make sure you don't hit the sulcus or any vessels. Punch, plug, stick a bandage. That's it. You're good to go for 3 years. That beats vasectomy. Vasectomy used to be the gold standard, but somehow the implant beats vasectomy, which was the gold standard. The IUD with hormone is number 3, and that beats tubal ligation. And tubal ligation used to just be like snip, snip, but now it's snip, snip, take out an inch on each side and burn it, but you still can get pregnant on it. It's not that likely. It's 5 out of 1,000 people will get pregnant on tubal ligation, but the IUD with hormone beats that. So that's some good birth control we have out there. Totally reversible, the implant and the IUD. A lot of people are like, wait, you're like making me infertile. And I'm like, if I was on a desert island with the hottest man in this earth and there was just the 2 of us left and I needed to become fertile, just reach up there, pull out the IUD, and in 2 weeks, we can make a baby. So if I were of age and fertile, now I've hit menopausal, so probably more difficult to do. But if I was 30 something, I could totally do that, as could anyone else with the IUD. So the implant, as I mentioned, is a rod that you a trained professional puts in your arm. But if we were going to third world countries, as I mentioned, a 10-year-old could be trained to do this. And then you just leave it there and it secretes progesterone. So those people who can't take estrogen, have risk of blood clots, high blood pressure, migraines with aura, etc., they can use this implant. And then it works for 3 years. The intrauterine device, IUD, you can see here is this little T thing. It's literally the size of 2 toothpicks, size of a T. And we put it in like this, and then it opens up like a little umbrella. It just sits in your uterus. And the one with hormone releases levonorgestrel, which causes the lining of your uterus to be thin. So if an egg and sperm were to hook up, it couldn't stick there and it couldn't grow for the 9 months. More importantly, the progesterone causes a plug at the bottom of your cervix, which is the entrance to your uterus. And so if the sperm tries to get through, bonk, bonk, can't get through. So that is the intrauterine device with hormone. Then comes the IUD with copper. And that one, the copper ions, I just think of it as lasers shooting out, pew, 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 pew. It's killing the ova, the eggs, it's killing the sperm, and I bet you it could probably kill a 2 to 4 cell the organism if the egg and sperm were to hook up. So that's how the copper IUD work. Birth control does not abort a fertilized egg. So in medicine, we don't consider you pregnant until the egg and sperm hook up and sticks to the side. And the example of this is with IVF. More and more people have become aware, right? You have a woman in Berkeley and you have her embryos at UCSF. She has egg and sperm hook up. Is she pregnant? No, because the embryos are not in her uterus. All right. She comes to UCSF clinic. We throw 3 to 5 embryos, depending how fertile we believe she is and how good these eggs are. And then none of them stick. She goes home and cries. She cries because she wanted to have an embryo stick, but none of them stuck. Did she just have 5 abortions? No. Did she just kill 5 embryos? No. They just didn't stick. It wasn't meant to be. So as a physician, we do not count pregnancy until the egg and sperm hook up and it sticks. Because if it didn't stick, then it's not a pregnancy. Also, if it doesn't stick, it doesn't start to make that hormone for the positive pregnancy test. So it's not going to happen until it sticks. So that, because that's beta HCG, human chorionic gonatrope, I think. Yes. The words are not coming to me. Menopause. I blame everything on menopause. Oh, expand the size of the screen being shared. Let's see if this helps. Oop. Is that better? A little bit, hopefully. Okay. There are some new medications out there I want you all to know. Generally, as physicians, we've been like, no, we don't like the patch. The original patch had too high of estrogen. So they purposely made a new patch that only has 30 micrograms of estrogen. The old patch, when we checked it in the blood, it had 50 micrograms of estrogen. And then, so this one was specifically made to have 30 micrograms. The only negative is it's a little bit more expensive than the older patch. But if you compare it to the birth control pill, it's a lot more expensive. The good news is under the Affordable Care Act. Thank you, President Obama Biden. I like to think of that. Former President Obama, current President Biden, for passing the Affordable Care Act, which resulted in no copay, no deductible, aka free. If you have insurance, they are not allowed to charge you anything for any FDA approved birth control. You can't demand, I want a specific brand when there are generics available, but if only a specific generic brand works for you, then you can usually, get it for free, no copay, no deductible. The exceptions are Hobby Lobby, which specifically went after that. And then any religious employer, I always forget and would have never thought of, Jesuit colleges. So Georgetown, USC, Santa Clara University. None of these sound religious, but they're Jesuit, and so they are allowed a waiver. I don't believe that's right because I don't believe any institution is going to go to heaven or hell. So therefore, how can you have a religion? If you don't have a soul, how can you have a religion? Certainly, you can be built on a religion. You could be a ton of your employees a religion. Let each person make their own choice. And that's what we're about. We're about choice. I love the Biden. Yes, that's pretty cool. If you have a body mass index of 30 or greater, then you can't use any of the patches because they don't work so well, and there's a greater risk of blood clots. And this new patch, relatively new, is called Twirla. For any geeks out there in the room, I just love graphs. And so if you look at this this dotted, the area under the curve is how much estrogen you're exposed to with the old patch. And then the new patch is this solid line. And then this hash peaks and valleys is the birth control pill. So although the birth control pill has a greater peak and a lower valley, but the area under the curve is still much lower than this higher one, which was the old patch. And so less estrogen equals lower risk of breast cancer, lower risk of blood clots. And so we like the newer patch, which has pretty much half the estrogen exposure of the old patch. There's now a 1-year vaginal ring. And when I saw this, I was like, woohoo, because there's so many physicians, pediatricians, internal medicine who don't have experience, don't feel comfortable throwing up an IUD. And we all had an opportunity to learn, well, not all of us, but many of us did, to do an IUD in medical school. But if you don't keep it up, then you don't remember, you don't feel comfortable, you don't feel safe. The vaginal ring, as you can see, is about the size of a silver dollar. It's bendy, soft, kind of like a stethoscope tubing. And the person with the vagina just sticks it up herself and leaves it. It doesn't matter what direction, doesn't matter where it goes, as long as it's delivering medication. The only negative of it is I'm an adolescent medicine specialist. So I want to educate you all to share with, your daughter, your granddaughters, your nieces, etc., that you should be on 30 micrograms of estrogen until you're 30 years old. So when I heard about this one, I was like, wait, you have 30 micrograms or 13? And they're like, 13. And like, it's so low, it's wonderful. And I was like, nah, that's not good. That's not good for people under 30. But if you're 30 and above, and 30 to 50 years old, or 55, depends when your menopause hits, you need birth control. So this is a great option. You stick it up there, leave it for a year, or if you like to bleed, you can stick it up for 3 weeks, take it out for 1 week, bleed, and then keep replacing it. It doesn't require refrigeration. The negative is it is $2,500, but again, under the Affordable Care Act, no copay, no deductible, aka free. Phexxi is a new birth control that's out there. I bring it up because they're pushing it, and all of the new generation is like, I want a birth control without hormones. And I was like, well, without hormones is not as good. So people who use Phexxi or spermicide, but Phexxi 15% will get pregnant versus a spermicide, which is 16%. And the big negative of this is also that it costs $353 for 12 doses. You have to put a new dose every single time you have sex. And if you all recall back in the day when I was 20 something, it was like 3 times a night. So that's $100 per night that you have sex. And that's a lot of money for a method that has a 15 to 16% failure rate versus a birth control pack of pills, $15, lasts you the whole month. And also has other benefits, which I'll go on later. A lot of people are very excited about over-the-counter birth control, and I would be absolutely excited if they let all the birth control pills over the counter. Know that there are 40 different birth control, 8 different progesterones. Unfortunately, the 2 that is about to go over the counter are not the good stuff. So I love hashtag get the good stuff. What's about to go over the counter is not the good stuff. If it were me, my friend, my daughter, my customer, my patient, I would not recommend this. What's going over the counter is a progesterone only pill. And the joke in medicine is, what do you call a woman who's on the progesterone only pill? You call her a mama or pregnant, because if you are late by 3 hours taking this medicine, who hasn't been late? Who doesn't travel from California to New York or New York to California or to anywhere 3 hours and forget to take your pill? And you had sex in the past 5 days, you will need to take emergency contraception to prevent unplanned pregnancy if that's your intention. And you need to abstain for another 2 to 3 days as the progesterone pill gets up to its dosage to protect you again. But we do provide it for breastfeeding women because we don't want to give those women estrogen, which would make their breastfeeding milk situation difficult to happen. But it's better something than nothing. But I would hate when this first birth control pill goes over the counter. Everybody's like, forget that. I'm just going to go for this one. So many people could end up pregnant. So please, 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 when this goes over the counter, make sure everybody knows if you're late by 3 hours, you will need emergency contraception and to abstain for the next 3 hours. But better yet, hashtag get the good stuff. If you can see a doctor, go see a doctor. And with Pandia Health, we bring birth control and expert care wherever you have internet and a mailbox. Pretty easy. You just fill out a questionnaire. Give us $25 once a year to use our expert doctors. We can prescribe in 15 states, and we're expanding as we get more money, and we can deliver to all 50, and we encourage birth control tourism. So we are in California, Florida, Texas, New York, Illinois, Pennsylvania, Georgia, Nevada. So if you're visiting Vegas or if you're coming to any of the Disneys, you can just fill out the questionnaire and say, I'm in California right now. And then you pay $25, and then you're like, but I live in Kansas. And we're like, okay, we'll send it to Kansas. As long as you were physically in one of the 15 states that we can prescribe, our doctor in those states can write the prescription, and then we can deliver it to all 50 states. You just got to get back to one of those states, or hopefully we'll expand to your state by then within a year. The next pill that's going over the counter is 20 micrograms. And that's fine, again, if you're 30 or over. But if you're under 30, not good for your bones. And only because I'm an adolescent medicine specialist at Stanford who thinks a lot about bones, especially as a woman of color. Asians, Blacks, Latinas, we suck at calcium. Out of the Asians, we don't drink much milk. And so you want your bone density. So make sure you have 30 micrograms of estrogen until you're 30. Teresa asked a good question. What's the difference between 15 and 16% efficacy? There is very little difference between 15 and 16. My point there was, don't blow $356 for Phexxi when you can just do spermicide at $5, $10 per pop. So sorry, I didn't clarify that on this slide. The reason I was comparing it is I was like, this is not better than spermicide. They like to say we're not spermicide, we're an acid contraceptive gel. And yes, they are a different mechanism, but their efficacy, that's all. Bottom line, how well do you work against preventing pregnancy? And what is the cost effectiveness? They're $353 for 12 doses versus spermicide is $15. Yes, foam and spermicide has a failure rate of 16% and very inexpensive. And generally I say condoms plus foam, not just foam alone. I generally say hormonal or copper IUD plus condoms, because condoms will prevent sexually transmitted infections. And you should just assume everybody has every sexually transmitted infection under the sun. Also make sure people get HPV vaccine, which covers human papillomavirus, which is the cause of cervical cancer, as well as pharyngeal throat cancer that's happened to a couple movie stars lately. Okay, the top 3 reasons for missing a birth control pill: forgot, away from home, no new pack. We have solutions. We have technology. There's an alarm. Almost everyone has a cell phone. You can set your cell phone to ring at the same time every single day until you take your birth control pill. One of my colleagues made a birth control holder. It's big, it's clunky, but it's kind of pretty. And if you have the 4x7, you slide it in and it detects that your pill is not missing and you set it for a particular time of day, it will keep ringing you until you take your birth control pill. So that's pretty cool. Yes, Teresa asked a good question. If you're 45 and above, can I get the HPV vaccine? Is there an age cutoff? So they did put an age cutoff at 26, and that's simply because insurance doesn't want to pay for it. But also, if you've had more than 2 partners, there's an 80% chance that you've been exposed to one of the 9 strains, and there's some cross coverage. But if you're willing to pay out of pocket and you're new to the game, like you haven't had sex in a while, or you're divorced or widowed or just back in the market, I would pay the, I think it's $900 to get the vaccine to prevent catching HPV. But that's why they don't do it above 26. If you've had 2 partners in your life, then there's like an 80 to 90% chance you'll catch one of the viruses that is in the vaccine. And there is some cross coverage, but for me, I'd rather be safe than cancer. And I hate pap smears. So any opportunity to prevent cervical cancer is a good one. Back to the slide, away from home, extra travel pack. I always recommend having one. I have one in my backpack. I have one in my purse. I have one in my travel toiletry kit, because I know if I run out of birth control pills, 1, I could be literally screwed. 2, I could be bleeding when I don't want to bleed. So it's very important to me not to get pregnant when I don't want to get pregnant, and to not bleed when I don't want to bleed. No new pack. This is where we need to educate doctors. This is where you need to educate your doctor, or your young person needs to educate their doctor. Ask for 13 packs at a time or 17 packs at a time. 20 states allow you to get a year's supply at a time if the doctor writes it as such. As a company that deals with pharmacies and insurances, I can tell you very few of the insurances are following the law. So if any of you want to take on an advocacy project, we should go after them for not following the law, but theoretically, that is the law. And as a doctor, I never realized that, because I was like, I gave you dispense 1, refill times 12, that's a year supply. But by doing that, I have chained the patient to the pharmacy every single month, because a pharmacy cannot expand a prescription. They can absolutely constrict. So if the insurance won't pay, they're not going to give out a year supply. They only give out what the insurance will give out. But we as doctors can write for 13 packs a year supply, or 17 pack a year supply if you're skipping the bleeding week. And then lastly, the whole point of my company was no one runs out of birth control on our watch. So sign up for a free delivery service. If you have a prescription and insurance, you pay us nothing. And we provide free delivery, automatic refills, annual reminders to see your prescriber. You can see we also throw in a goodie. Default is high chew, but sometimes makeup, sometimes stickers, sometimes nail files, sometimes a pen, some random goodie. And then there's also a postcard. We call that the Pandia PSA, public service announcement. With the 1-year supply, most pharmacies in general give you something with 6 months minimum expiration, but a 1-year supply, they have to make sure they give you ones that expire in 2 years. So I just picked up some emergency contraception, and we as a company always write, please give the patient the one with the farthest expiration date. And so, because it's not for immediate use, it's for future use. And the one I got is 18 months. So if they're dispensing a year supply, hopefully they would give you something with 18 months expiration, and definitely not within, 13 to 17 months. That would be illegal. Or if you notice that, don't leave the pharmacy and be like, once you leave the pharmacy, you cannot bring the drug back. But if you're at the pharmacy, look at it and be like, this expires too soon, please give me another. And they can do that. So great question. All right. Next slide, emergency contraception. So this is another slide where about 4 or 5 years ago, I gave a talk to a bunch of Stanford internal medicine residents, 60 of them, and only 1 out of 60 got the next question correct. So here we go. This is a list 4 methods of emergency contraception and from most effective to least effective. And only 1 out of 60 got it correct. And of course, it was the one with the uterus, but there were, I think 50% of the people in the room had a uterus. So it was unfortunate, but hopefully now they all know. And I try to give them a talk every year, but if they don't invite me to come talk, then they may not know. So here we go on the left. Before I go into this, I see a question. What is the impact of intense heat on birth control pills? They live in Arizona. So if it's in your mailbox too long, then that's not a good thing. Most medication is meant to live at 75 degrees, maybe 80 degrees max. So it's just important to keep them at room temperature. Hopefully your rooms are on the cooler side, but always ask your pharmacist just to be sure. But most of the drugs, I mean, if you're on 30 micrograms and other people are taking 20 micrograms, you're probably covered. But if you're on a 20 or 10 microgram, definitely if you're on a 10 microgram, then that's not so good. But the difference between 30 and 20 is 33%. So if you have a 30 microgram pill, it could lose 33% of its efficacy and still be efficacious as if you took 20 micrograms. It's just not as good for your bone density. But yes, if you are in a hot place such as Florida, Arizona, Texas, getting it by mail, that is definitely a consideration, being too long in your mailbox. So know what time your mailman comes. With respect to emergency contraception, the new stuff is the hormonal IUD can be used for emergency contraception, as can the copper IUD. And people are like, what? Aren't these long-term birth control? Yes, the copper IUD lasts 10 to 12 years. The hormonal IUD, depending which one you stick in, but the general one that should be used for emergency contraception lasts 5 and potentially up to 7 years. But if it were me, my daughter, my friend, or anybody who is of reproductive age who was sexually assaulted, I would ask for one of these methods to be put in after they do the rape kit, because the copper IUD is 99.99999% effective in preventing unplanned pregnancy within 5 days of sexual assault or condom popping or stuff like that. But if you can tolerate 3 out of 300, so 1% failure rate, then the IUD with hormone is a good one. The main reason I don't like the copper IUD with hormone, the 2 main side effects, more blood, more cramps. And if you're a person who's like, oh, is that blood running down my leg when you get your period? You are a great candidate for the copper IUD. But if you're like me, I feel every cramp and every blood that drips out of me. No, not a good candidate for the copper IUD. The hormonal IUD, I'm just a huge fan, because 30% of the people that go on there lose their periods and they're like, yeah. And then the other 70% are a lot lighter. So it's just a great option, as is the implant as well, because of their amazing efficacy. But now you can also use it for emergency contraception. All of these beat Ella, which is the prescription emergency contraception, and is the one at Pandia Health that we advise people, because it beats Plan B and its generics. And so people, given Roe v. Wade, have been like, everybody go get Plan B and its generics. But the important thing to know about Plan B and its generics is if your body mass index is 26 or greater, it doesn't work so well. If your body mass index is 30 or greater, it does not work at all. And 60% of this country has a body mass index of 26 or greater. So it is irresponsible to be pushing this drug unless you also say, check your BMI and don't buy it, don't use it. If it's a BMI of 26 or greater, not so good. BMI of 30, definitely don't use it. Not going to work at all. Waste your money. Don't even bother. And we had thought if we doubled up on it, that maybe it would work. It seemed logical, but a physician of color tested it out in her research and found that it didn't work with doubling it up. So that was very disappointing. However, Ella, which is prescription only, but you can get it in advance of need. So anybody who's going on any birth control method, pill, patch, ring, et cetera, but if you're on the IUDs, you don't need it, or the implant. But if you're going on pill, patch, ring, or just condoms and spermicide, I absolutely would get a prescription for Ella, fill that prescription and ask for one with the farthest expiration date. And that's exactly what I've done in case of sexual assault for my 2 daughters, or in case the condom pops or anything like that. So Ella, again, because it's prescription, no copay, no deductible, AKA free if you have insurance. And it's also covered for those in California by Medicaid, nationally, probably by Medicaid as well. And unless you're some conservative state that opted out of Medicaid, Texas, I'm talking about you. So, and then lastly, if you have a bunch of birth control pills with levonorgestrel or norgestrel, you generally can take 4 tablets now, 4 tablets in 12 hours, but this is most effective to least effective, and that is the least effective method. But if that's nothing else you got, better something than nothing. And then you could go back and go get an IUD if you really, really wanted to prevent unplanned pregnancy. So this is just showing you the pregnancy rate in blue is with Plan B and its generics. The pregnancy rate in red is with Ella. And I know it's just a 1.5% difference or a 0.8% difference. But if you are in that 0.8 or that 1.5, it's 100% difference. So why would you use an inferior product? Why would a doctor suggest that you use an inferior product? If it were me, my daughter, my friend, I'd want the best, most efficacious one with the least amount of side effects, and this fits the bill. It is slightly more expensive if you have to pay out of pocket. It's $40 versus $20, but again, an abortion or an unwanted pregnancy is going to cost you a lot more. So just a recap, if your body mass index is 26 or greater, Plan B and its generics don't work so well. Consider Ella, Olapristal, or an IUD. If your BMI is greater than or equal to 30, Plan B and its generics do not work. And then if your BMI is greater than 35, your only option is an IUD. Is the IUD copper also flexible the way the IUD with hormone like Mirena is? I would say that the Mirena is not that flexible. It's like 2 sticks, but it pops in and opens, and the copper IUD is similar. So I would say they're equal. It is possible that the Mirena IUD is a little more flexible, but most people don't notice it. It's literally 2 toothpicks in your uterus. So it's not like pokey, and it's not pokey toothpicks. It's just rounded and smooth. It's not pokey. So don't worry about that. The main thing that has happened is if somebody doesn't know what they're doing, they're new to it. So you want to find somebody who's done at least 50, though then how is a person who's never done 50 ever going to learn? But still, if it were me, my daughter, somebody who's done at least 50, then there's a lower risk of them perforating your uterus. And it's not like your uterus blows up. It's just like a needle getting stuck in the muscle or something, and they can take it out, but it won't prevent unplanned pregnancy if it's in the wrong place. Though if it's releasing hormone, it might. I would love to give a sex ed class to Congress. I think they should all come to my sex ed class. And a lot of my talks are online at YouTube. So feel free to share them with anybody who wants to be educated. Check out Pandia Health YouTube. All right. I was distracted. Oh, yes. The reason I'm distracted is I love this. This is the only slide that I do animated. So I'm going to do it animated. You want to get your emergency contraception in advance of need, and you want to think of it like a fire extinguisher. You want it ready to go when that condom pops, when you have sexual assault. I tell my patients if the condom pops at 3 a.m., I want it in the person in the uterus's mouth at 3:10. I do not want any cuddling, huddling, waiting till the morning after, waiting till 5 days after, because you just heard me say any emergency contraception can be used up to 5 days after, but it doesn't work so well. The sooner you take it, the better. So 3 a.m. condom pops or sexual assault, 3:10 in your mouth. And so by having it around in your house, you can be like, where is that? Go grab it and take it. Okay. And then, so then you can put out the fire. Otherwise, you have to run to the pharmacy. You have to get to the pharmacy. You have to come up with money. You have to see if it's covered by your insurance. You have to argue with the anti-science pharmacist who says that emergency contraception is abortion when there is no such thing. And the FDA, awesomely enough, just declared and confirmed what we knew for the past 10 years, that emergency contraception is not an abortifacient. And it's really important that people understand that. If you are pregnant and you have a positive pregnancy test and you take emergency contraception, nothing happens. If you want to terminate that pregnancy, you have to go to plancpills.org or get some medication abortion or a surgical abortion. So if you don't have emergency contraception when you want it, that's your last chance to prevent unplanned pregnancy, then your house burns down, aka you are pregnant when you don't want to be pregnant. Someone else asked, how common are issues with IUDs? I do have Dr. Yen's 3 tips if you are getting an IUD put in. So for anybody who wants to share it out there, or actually the new hot thing in menopause treatment is rather than taking a progesterone pill every day or 2 weeks out of the month and then you bleed, you can actually have an IUD put up there and it will release progesterone for 5 to 7 years, saving you the hassle of having to take a pill every single day, which many of us of menopausal age are strongly considering. So to get an IUD put up, my 3 tips are: 1, consider going when you're on your period, because then that hole is already open, but it's totally fine to put an IUD through that closed cervix. It's fine. We do it. It's no big deal. It's a small, again, it's just a toothpick, but if it's open, even better. Not on the first day of your period where all the stuff's trying to get out, but on like the last day of your period. If you can schedule that, that would be good. And then number 2, take ibuprofen, 600 milligrams with food. That's equivalent to a shot of morphine. If you take it with food, pain-wise, to decrease the risk of pain, assuming you don't have any kidney problems and no allergies to ibuprofen. Ask your doctor first, but it is an over-the-counter drug. And then lastly, ask them to numb up your cervix. They used to be like, we don't know if that works or not, but the latest research has shown it does work. And so ask them to numb up your cervix, so when they put in the IUD, it doesn't hurt so much. So those are Dr. Yen's 3 tips to tackling the IUD when you go on. Another tip, know the difference between good and bad telemedicine. So there are a ton of different telemedicine companies out there. If it's your doctor doing telemedicine, that's totally fine. But if you're doing something new, birth control, menopause, acne, and you don't have a doctor and you're like, oh, what company online should I use? These are some things to think about. Who is the CEO? Who is the founder? Are they a physician or not? Because if they're a physician, they've taken the oath, do no harm. At Pandia Health, we are the only doctor-led, the only women-founded, women-led company in this space. And I'm the only CEO in this space, to my knowledge, birth control delivery, that has taken the oath, do no harm. We will always tell customers what's best for your health, even if it doesn't benefit our bottom line, because we plan to be your friend from your first period throughout your entire life. And if we don't catch you here, we'll catch you later. If we don't catch you, we'll catch your sister or your niece or whoever. You know, we're all about doing good in this world. Next, do they list their providers? We go to our competitors' sites, they don't put the first and last name. Why don't they put the last name? They put Dr. Cheryl is happy to help you. Well, what is Dr. Cheryl's last name? And why won't Dr. Cheryl tell us what her last name is? And because maybe they have a ton of turnover and they're treating their doctors poorly, or their doctors are not the doctors you want. You know, telemedicine 1.0 is cheap, fast, online. Is that what you want for your health? We are not expensive at Pandia Health, but if we were more expensive, you know, hashtag get the good stuff. This is your health. This is not a lollipop. This is not an eyeliner or pencil or what, a cloth or whatever, fast fashion. This is your health. And then are they opt-in, opt-out? We've seen dubious behaviors in our competitors where they're like, oh, can we send you some internal condoms? And if I were a 20-year-old, I'd be like, yeah, sure, send me some condoms. And then they send them female condoms, which if you're not familiar with is like an IUD hooked up to a condom with crunchy sounds. And I've never met a heterosexual female that uses the female condom. I've only seen men who have sex with men, but this company automatically sent out 20 condoms to 200,000 heterosexual females, and they just buffed their bottom line. And that cost has now gone to our taxpayers. That cost has now gone to all the insurance companies. And those of us who needed our insurance company to cover whatever, there's less money because it was eaten by this. Are they experts in their fields? I'm all for primary care physicians doing everything. But if it were me, my daughter, my friend, I want the best and the brightest. I realized I spent the past 6 years only doing birth control pills. Other people are doing COVID, a runny nose, scraped knee, blah, blah, blah. All I've done is birth control. So I've taken my UCSF, Stanford, MIT brain and applied it to birth control pills, come up with an algorithm that, particularly for women of color, realizing what we were taught in med school works great for a Caucasian female that wants to bleed every month. But if you're Asian, Black, or you don't want to bleed every month, I've ranked all the pills from most likely to make you bleed, least likely to make you bleed, most likely to give you munchies, least likely to give you munchies, most likely to give you zits, least likely to give you zits, and optimized it. We have 82% retention at a year versus the standard 55% retention. And that's because we give you a good pill. Hopefully you'll like it. And then 7, sorry, I should wrap up because time's up and leave it open for questions. I run yappy, I warned Deneen. Hormone therapy. Let's not call it birth control. Let's call it hormone therapy to level the playing ground. And the example I give is pre-med, MIT, biochemistry final. All of a sudden, bleh, blood. And I'm like, do I run to the bathroom or do I finish the exam? And any of you who are pre-health or very competitive fields, you know the answer. You finish the exam. And then I look to my left, I look to my right, 2 people without uteruses. Not a care in the world. Would that I were they. I have 2 daughters. And do I want them hit randomly with blood 1 week out of 4 while they're taking their SAT, while they're taking their pre-med finals if they're pre-med, or anything in life? No. And so we now have the technology to make #periods optional. So I'm going to run through my periods optional talk real quick and eat into our Q&A because you are welcome to throw down Q&A questions as we go along, but you can also stop me if you want. So I have a TEDx talk. If you go to the bottom of pandiahealth.com/periods optional, this is this talk in great length, but I'm going to quickly summarize it for you. I realized that menstruation should be obsolete. I realized trying to get pregnant in 2016 with my first child, the only reason those of us with uteri bleed, every month we build that lining and we're like, embryo? Oh, no embryo, bleed. And then every time we build that lining, we risk endometrial cancer or uterine cancer. Every time we pop out an egg, we risk ovarian cancer. And all doctors know that if we were to turn off the ovaries for 5 years with the birth control pill patch ring, we can decrease women's risk of ovarian cancer by 50%. There is no other way to get rid of the risk of ovarian cancer other than take out your ovaries, which we would not recommend because you have premature menopause. But after your uterine bearing years, if they're going to take out your uterus, then they should just take out your ovaries to decrease your risk of ovarian cancer. But the only reason we build this lining every month is to catch an embryo. And as you all know, in the United States, we start our periods at age 12 and we end our periods at around 50. And 2 years in there, we'll pop out 2 kids. But all those other years, why are we building and sloughing and hormones up and hormones down and random blood 1 week out of 4? If we're not trying to catch an embryo, if you're trying to catch an embryo, yes, you got to do this. But if you're not, then we now have the IUD, the implant, the shot, the pill, the patch, the ring to make #periods optional. And people are like, that's not natural. And yes, we as doctors have pushed it in everybody's heads that yes, you must bleed every month. And yes, if you're not on any medication, you better be bleeding every month in our first world country 2 years after your first period, because for the first 2 years it can be whack. I'm an adolescent medicine specialist, just want to throw that out there. But after 2 years, it should come every month. However, the normal human biology is fewer menses. And Dr. Beverly Strassman, anthropologist, studies the Dogon tribe of Mali in Africa. And this is not like decades ago. This is now, today. And they die at the same time we do, 70 to 80, not like 30 to 40. So we're comparing apples to apples. And women were banished to the menstruation hut. She studied them for 736 nights. And here on the left is the Dogon tribe, what is, quote, natural. Here on the right is the US of A and first world countries. And so we have delayed and decreased childbearing. They start their periods at 16. We start our periods at 12. This is a matter of nutrition. Once you hit 100 pounds or 22% body fat, then your body's like, you got enough energy, let's make some babies. And so we have a lot of nutrition in our first world countries, as we talked about body mass index. So they have 7 periods a year, same thing, nutrition. We have 13 ton of nutrition periods per year. But more importantly, they have 8 or 9 children in their lives. Remember back in the day, we only have 2 children. How many periods do you have when you're pregnant? 0. They have 12 months exclusive breastfeeding. We breastfeed for 0, 3, or 6 months. How many periods do you have when you're breastfeeding? 0. And this is the kicker, the TLDR. They have 100 periods in their lifetime. We have 350 to 400. We have enough periods for 2 to 3 other women. We have ovarian endometrial cancer. They have none. They are constantly, as my OB/GYN professor would say, pregnant or breastfeeding. And over here, we are incessantly menstruating. Love that Teresa studied anthro. And high blood pressure and IUDs have been explained to be contraindicated. I do not believe that IUDs are contraindicated in high blood pressure. High blood pressure does contraindicate anything with estrogen, but the IUDs do not have estrogen. They only have progesterone. And then the same thing with the implant. But I have to check on that, but I'm pretty sure people with hypertension and high blood pressure can have progesterone only options. I'll check that and get back to you. The benefits of menstruation, I would say people think that you have toxins building up and you need to clean. No, you don't. What it is you built up a level 10 lining and it's waiting for an embryo and it's like, oh, no embryo, you dump it. But with the birth control pill, patch ring, IUD, implant, shot, as I mentioned, it only goes up to a level of 1. And so you don't have this build up that you need to dump. It's just there, and you can decide to rinse it out every 3 months, every 6 months, or never. I personally hate blood, so I haven't bled for the past 13 years, and I'm not menopausal yet, but I'm probably menopausal now, as long as I take my medications. Do I encourage breastfeeding? I absolutely encourage breastfeeding. Breastfeeding is magical. It's painful. For those of you, I'm sure you all know, I thought residency was the worst thing in my life. Every 4th night, I had to pull an all-nighter for 3 years in a row. That was hell, because if I don't get sleep, I get very, very toxic. But with breastfeeding, as those of you who've done it, and you know, it's every 2 to 3 hours for 3 months in a row, nonstop. That was very toxic. But it's also great for losing weight. I was able to, with breastfeeding, go down to pre-pregnancy weight and wear my wedding dress. And that was like 16 years before I got pregnant, and eat a cupcake every single day. So that was kind of awesome. But the hard part is you got to stop eating those cupcakes when you wean the baby off your breast, or the weight all comes back. So unfortunately, I'm no longer at that weight. But breastfeeding was pretty amazing, but it was hell. But it was good for the kid. It prevents infection, particularly in COVID. Before we had the vaccine, we can give the baby, stuff, and they don't, COVID vaccines, I haven't kept up to date, but I don't believe they're giving it to infants. So definitely, if you get the vaccine, you breastfeed, then you can give your baby antibodies. So that's pretty cool. And then question, do I promote girls 12 years and up to get birth control until they want to have children and then go back on it after they're done? So exactly that. I have 2 daughters, one that's 16, one that's 13, and I've given them the option of making #periods optional. I do not recommend turning off the periods if you come from a short family and you want to maximize height. So we are an Asian short family and we want to maximize height. And so wait 2 years after their first period, then they've maximized their height that they're going to get to. Because if you throw estrogen before then, you theoretically could lose 1 to 2 inches of growth spurt during that time. But 2 years after your period, you no longer grow on average. And so, but if I had one mother whose daughter was already 6 feet and she's like, it's fine. And so we started her birth control pills, not for birth control, but for making #periods optional, leveling the playing ground, improving her academics, decreasing her risk of ovarian and endometrial cancer. And they've never shown any long-term effects of the birth control pill, patch, ring, IUD, implant. And as soon as those hormones are out of your body, you can get pregnant within the next 14 days. So no long-term effects. No, the joke is, does birth control make me sterile? Yeah, while you're taking it, that's why you're taking it. But as soon as you come off, the reason you see that bleed is that hormone is washed out of your body by day 3, and at the very least with enough half-lives by day 7. So all those hormones are out of your body. The only exception is the shot. The shot is stored in your muscles, and sometimes it takes 8 months to get pregnant. But if you're a teenager, I think you could wait 8 months to get pregnant. Do I promote implant more than IUD? And my thoughts on getting a second IUD. I believe that whatever works for you is best. I think the IUD and the implant are so good that it doesn't matter which one goes for you. The IUD I like because it is lower hormone and it's focal. The implant goes through your whole body. So if you just want less hormone exposure, but the hormone that's in the IUD is the one that potentially could give you munchies and zits, but it is a lower dose. So each person is different. And then the implant is the hormone that I like that has been shown, I've noticed, to work better in Asians and Blacks. So again, each person's different and we need to study it more. Somebody asked about fibroids and birth control. I have to look. Does it prevent fibroid tumors? I believe that the current thought is that estrogen may increase the growth of fibroid tumors, but the progesterone in it, certainly, it might be better to be on a progesterone only method if you have a family history of fibroids. So that would be an IUD with progesterone or an implant, or there is one good progesterone only pill, but it's just crazy expensive. So if everybody went on it, it might kill the healthcare system, and that's drospirenone. That's about $230 a month currently, but once it goes generic, that would be a good one. That one is more forgiving. You can just mess up every 24 hours like a birth control, normal birth control pill, as opposed to the 3-hour one. So these are some options. Oops, sorry, I didn't go over that slide. This slide, everything is better with stable hormones. And so I want you all to realize, if you don't already realize, that the pill was invented by 3 dudes. And one of them was a devout Catholic OB-GYN, not like a once a week Catholic, but a every day at 7 a.m. Catholic. And he did have the brilliant idea, maybe we could get the birth control pill through the Catholic Church. If we made periods regular, then you can abstain from sex during the fertile days. And he got it through the nuns. Nuns are very liberal. Got it through the priests. I don't know how. It got to the Pope figured it out and vetoed it because Dr. John Rock won that argument against his 2 co-founders. And the 2 co-founders were PhDs. They're like, why are you making women bleed every month? It could be every 3 months, it could be every 6 months. And if I was there, I'd be like, yeah, give women choice. Don't force them to bleed against their will. But he really wanted to get it through the Catholic Church. And because Dr. Rock won that argument, every method since has forced us to bleed 1 week out of 4. And that bleed is totally artificial. That 3 weeks and then drop a week with sugar pills, you just keep the hormones going and you won't bleed. And if you want to bleed, you can bleed every 3 months, every 6 months, or whenever you forget to take a couple pills, you will bleed, and then just make that your bleeding time. And so acne is better with stable hormones. Arthritis is better with stable hormones. Depression is better with stable hormones. Diabetes, seizures, anything related to periods. If we get rid of your periods, then you don't have painful periods. You don't have heavy periods. You don't have premenstrual syndrome. The #1 cause of anemia in a menstruating woman, menstruation. If you have a bleeding disorder, we definitely don't want you bleeding, because when you bleed all over the bed, and then we need to transfuse you. And as I mentioned before, it decreases ovarian, endometrial. And the last one I want to bring up is colorectal cancer. And it's because we need to hashtag stop sucking it up. Well, those of us with uterus suffer through so much, and we don't complain. Like, that's the way it is. That's just life. It's what it is to be a person with a uterus. And 30% of people who have bad, evil periods, or just periods, also have constipation or diarrhea. So like, add insult to injury. Not only you got blood coming out, but now you got poo that doesn't go right. And when you mess up your pooing, you increase your risk of colorectal cancer. And so by decreasing the up and down every month, you decrease your risk of colorectal cancer. To have an IUD for 5 years and get another, you don't feel any risk as long as the person is qualified. Absolutely. I would keep doing the IUD as much as you need. You could stretch it out. Most IUDs can go to 7 nowadays, but if you start to have bleeding and you didn't have bleeding before, then I would ask to get it changed, because I think that means its hormone has run out, and each person is different on how fast they eat through the hormones. And then financial education. If I didn't mention it, painful, evil periods are the #1 cause of lost school and work in women under the age of 25. 10 to 45% of adolescent young women miss school because of bad, evil periods. And then the Chinese Olympic swimmer about 6 to 8 years ago came out of the pool and she's like, I have a cramp. I think it messed me up by a millisecond. And I was like, who is your doctor? If I were your doctor, you would no way be bleeding anywhere near your Olympics. right? And then the US soccer team, same thing, like, ooh, we got this period app and it lets us sync and sleep and nutrition. And I was like, who is your doctor? Because if I were your doctor, you'd have no periods and you don't have to worry about eating, sleeping, syncing. Of course, I want you to be healthy and do all that stuff, but it doesn't have to be related to your periods. It's just hashtag periods optional. Don't even risk that while you're doing your sport, particularly tennis, right? In your white skirts, but soccer as well. And then lastly, if none of that convinced you and you're very green and environmental, those of us with uteri use 10,000 to 13,000 tampons and pads, right? How many of us have all of this in every single bathroom and in your purse and in your backpack and your briefcase all the time? We could at least decrease this by a third. And then, as I mentioned before, we've put it in your head, you have to have a period every single month. And yes, if you're not on any medication, you better have a period every month unless you've hit menopause. And then those that are perimenopausal, you could have whack periods, maybe go on medicine to make hashtag periods optional. And then every 6 months, we could take you off and be like, am I there yet? Am I there yet? But I would also recommend considering hormone treatment on the other side for your brain and bones and heart, but that's a different talk. And then, but if you're on hormones, you don't have to bleed every single month. So again, if you want to recap this talk, pandiahealth.com/periods optional, share it with anybody with a uterus. It will blow their minds. And then lastly, get angry and active. Don't get angry and apathetic. Vote, volunteer, donate to, amplify pro-bodily autonomy, pro-abortion rights candidates such as Governor Whitmer, Stacey Abrams, Reverend Senator Warnock, Secretary of States. And then please share Pandia Health. Please follow us on all of your socials. And I went over, but I think that was fun.
No, that was not over in any means by any stretch of the imagination. First of all, I warned everybody to be ready by around until 8:30. So I gave us a nice soft buffer. And that was so informative and so eye-opening and so infuriating in some ways. I have to digest all of this. This is insane. I knew it was going to be fantastic, but it exceeded my expectations. And they weren't low. Like, I just knew that this was a great connection, and we are so fortunate. Did we miss any questions in the chat? I know it's super hard to stay on top of these. Shell, I just want to acknowledge that you mentioned that you had a bad IUD experience, some PID afterwards. Yes, I feel so bad that has been your experience. And I guess, unfortunately, with the human body and with healthcare and with medicine and with everything, there is potential for risk of some not awesome outcomes. Hopefully you've been able to come through all of that, Shell. But thank you for sharing that. I definitely honor your experience. My goodness. Wow, I thank you so much. I am going to grab a quick list of all of the socials for Pandia Health, and Dr. Yen has done us an amazing service where we are partnering with Pandia Health, and I will put that promo information in there. I'm just gonna snag that real quick here. Oops, there we go. And put that information in there, and then we will put the socials in there so that everybody has access to that. Again, we will be sharing the replay. This has the link for the invite so that you can get a discount. Please share Pandia Health. My brain has popped off. I want to maybe consider bringing you back for the menopause thing, because I'm right there. It is a nightmare. My biggest complaint right now is the weight gain thing. I know that sounds super vain, but I'm irritated by it. It's because it's just stuck. We have so many different avenues and upcoming projects and missions that we're looking at that we would find you very valuable to inform and guide if you're open. And of course, yes, we would be honored to have you as a member. And I personally would love to gift you that membership if you're open. And so just because I think we're a great fit, and I definitely appreciate your expertise and your passion. And you have hit all of the important sweet spots for a BPW member, where it's the information, the amplification, the advocacy, and things that allow us to take action. So you're the trifecta and beyond. Thank you so much. From Deneen and Carrie, if you have any last words, feel free to jump in, or President Megan. I just want to thank you all for joining us and spending this 50th anniversary of Roe, at least getting education and options, right? So thank you again, Dr. Yen. We are so grateful. We'll be in touch for that membership, and stay tuned, everybody, for the replay and the follow-up information for those links. If you have the opportunity right now, though, save that chat. There's juicy bits in it, lots of juicy bits. All right. Thank you all. Have a great night. Take care, everybody. Bye-bye.